first I have to put here medications. I try, when I talk about treatment for the many conditions I talk about, I always try to put medications last, but unfortunately in this case I think it has to be first. I mean, so many people are having it that we are now aware that this is just part of the normal behavior of the body, how it is um, reacting to the changes that we have made, because we're not supposed to live uh, this long. The body is not made to live forever. But since the medicine and the conditions of life are improving, we are living longer. So the eventually we're going to start having certain conditions. So it is not very possible to simply get rid of this with anything different from medicine. Of course, you can prevent it and you can help medicine, but definitely um, the medicine is the number one thing in this condition. We use different types of medication. Of course, diuretics, which are water pills, well, commonly known as water pills, is one of the best medicines we use. Very obvious, related to what I was saying. So it goes and acts in the kidney, helping it get rid of the extra water. So if you have less water, less blood pressure. And we also have certain medications that act directly in certain chemicals that help with the contraction and relaxation of the arteries. It's also helping the arteries be more flexible like that. I mean, there are several types of medication and several ways of how they actually do that. I don't think that's something you would like to hear about, but basically they act either in the kidney or directly in the arteries. There's something that is called the DASH diet, and if you are hypertensive and you haven't heard from this, that this is definitely something uh, you should research a little bit more. It's DASH. It's simply what the American Heart Association and many other associations, including the Task Force for High Blood Pressure, recommends nowadays, which is of course low in sodium and high in potassium, or at least this is a good guideline for what you should do. I recommend the DASH diet.